Hi, my name is Dr. Eddie Hooker. I'm a professor of health services administration here at Xavier University in Cincinnati, Ohio. I'm also an emergency physician at the University of Cincinnati Medical Center. I'm here today to train you in the new way to do CPR, hands-only CPR. The Department of Health Administration, both our graduate and undergraduate students, have been training people for years in the newer way to do CPR. That's hands-only CPR. I want you to know that way, and you will learn it in this very brief 3 to 4 minute video how to do that. About 350,000 people suffer cardiac arrest every year in the United States. Most of those people don't stand a chance and don't survive their cardiac arrest. If nobody starts CPR before EMS arrives, only about 3 to 4% of those patients will survive to hospital discharge. However, if somebody, a family member, a bystander, starts CPR, that chance of survival jumps up to 20 to 30%. So we really need people doing CPR before EMS arrives, which we call bystander CPR. So why don't people do CPR? The biggest reason I hear over and over again is that they're afraid they're going to hurt the patient. You can't hurt somebody that's dead. You're only helping them. Their only chance of survival is you starting CPR. So don't worry about it. If a rib gets broken, being alive with a broken rib is better than not alive. Okay, so please, I need you to start CPR. The other thing people are worried about is, well, I don't have a current card. I took a class 3 years ago. I can't start CPR. Well, guess what? You don't need a current card. There are Good Samaritan laws in every state. You just need to know how to do the CPR and do it. So let's talk about the new way to do CPR. Both the American Red Cross and the American Heart Association have endorsed what's called hands-only or compression-only bystander CPR for adults and teenagers. This means we no longer check a pulse. We no longer do mouth-to-mouth. We've actually shown that survival increases if you eliminate mouth-to-mouth or rescue breathing, because the thing that saves is compressions. So we don't want you to do the mouth-to-mouth anymore. We don't want you to check a pulse. All we want you to do is to make sure the person isn't responding, and if they're not, and they're not breathing, start compressions. You can dial 911 right away and let them be sending EMS, but somebody needs to start compressions right away. That's what can save lives. So let me show you the new compression-only CPR. It'll only take me a couple of minutes to demonstrate. I'm going to demonstrate using a mannequin that you can buy yourself if you want to off the internet from Amazon or from the American Heart Association. They're about $40. Or you can even use a pillow to practice compressions. The key is just do CPR. Any CPR is better than no CPR. So let me show you how to do compressions. We have a victim of cardiac arrest. We shake them. Hey, you! They don't respond. They're not breathing. You need to just start compressions. You put one hand in the center of the chest, the other hand on top of it. Lock your elbows and use your body. Don't try to use your strength of your arms. Use your body to do the compressions. So you just push down, and we want to do it fast and hard to the song Staying Alive. Bump, 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 staying alive, staying alive. Bump, 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 staying alive, staying alive. That's all you need. That is all the training you need. You just need to push fast and hard in the middle of the chest. Again, you want to try to call 911. Either just take your cell phone out of your pocket, dial 911, put it on speaker, and you don't have to wait to start CPR. They'll hear. They can track where you are, and they can send help. But you need to get started with compressions only. It's that simple. Please do CPR if you see a victim of cardiac arrest.